My name is Dr. Robin Zahn. I'm with Michiana Hematology Oncology, located in northern Indiana. In today's conversation, what I tried to show is how can we optimize telehealth in the future, post-pandemic. I had the opportunity to review 3 abstracts, one from Mayo Clinic, one from MD Anderson, and one from Memorial Sloan Kettering. And what we learned is that there was an increase, as there was much across the country, in uptake of telehealth right after the pandemic started, and now it's plateaued. In addition, we found that patient-reported outcomes were improved with telehealth, as well as now an opportunity to do informed consents for early phase 1 and 2 trials with telehealth. What this tells me is that telehealth is here to stay, but there is room for improvement for access and equity, for example. There's research that needs to be done, and there's innovative work that's being done looking at telehealth, including in the virtual hub by ASCO, as well as Tele-Oncology Virtual Hub with the VA, from which we can learn. And hopefully we'll be able to evolve telehealth so it improves high-quality care for all individuals, especially to improve quality care for those who are disadvantaged and don't have easy access to health care.